right here. So you had been on FOLFOX with the bevacizumab, and then they had to hold the oxaliplatin because of the nerve damage, right?
Mm-hmm.
And so, do you know what we've been getting recently? What chemotherapy? Because you said you've been on the lighter chemotherapy, right? Hmm? You're not sure? Okay. And who is your oncologist at home?
Dr. Normal.
Okay. So I think what I like to do, and see what Dr. White thinks, but what I'd like to do is, because you haven't seen one of our medical oncologists here, right? Okay, you've only seen us, the surgical team. So I'll put you in touch with one of our medical oncologists, okay? Because they can look through your chemotherapy regimen, see what you've gotten, and then try to identify a regimen that they think is going to work better for you, okay? And get you back on better chemotherapy.
So she'll be taking it here, right?
No, it can
Or
be
back
done
home?
at home. It
Okay.
can still be obtained at home, but they would give their input. They would look through and give you an insight as to what they think might work better. They can also start identifying what, second line, third line drugs might be available based on your tumors and its mutations and things like that, okay?
So is there any way possible to get that treatment done here? Because back home, I'm not going to lie, they're pretty garbage.
Okay.
Which is why, because
Yeah.
I just lost my actual mom. This is my godmom to cancer. And I had been trying to get her here for like the longest. Back home, they're like, it's horrible. When I tell you, like, it's just like, people when they come here, and it's just like, you can tell, like, the difference in their improvement and how y'all handle them, as opposed to, like, there's a crap ton of people who wants to go somewhere cheaper or somewhere faster, or quicker.
Yeah. No. So the one thing about chemotherapy, and it may be that you want to come here, and that's totally fine too.
Mm-hmm.
It can be inconvenient to try to get chemotherapy so far away from your house.
Oh, well, as long as I have my car, she's going to be fine.
Where do y'all live?
Well, I stay in Dallas, but she's in Longview. But it's the same distance.
Okay, gotcha.
Yeah.
Gotcha. Yeah, so I mean, if that's what you want to do, certainly there's ways to do that, yeah.
Mm-hmm.
But my point is our medical oncologists are very willing and able to work with people's home oncologists to make sure they get the treatment, the
right
drugs
treatment. Right.
that they would want you to get here, right?
Okay.
So that can be done. The now, if there may be some, if we go on clinical trials or where drugs are not, considered standard of care,
Mm-hmm.
for those, she might have to come here to get that, right?
Okay. Mm-hmm.
The point being, though, ultimately that if we can get you onto more effective treatment, and it does a good job of controlling the disease, we may yet still be able to go back to a surgical plan where we clear all the disease out of you. You understand that? We're just not at that point now.
Right.
Okay? Does that make sense? Okay. So I'm going to put in a consult for medical oncology. Okay? For one of our colorectal cancer specialists to see you, go over your disease, go over your, mutation and the history of the chemo that you've gotten, so they can figure out something that works better for you. Okay? What questions can I answer at this time?
So the mass on my liver. I'm sorry.
It's developing more. It's like little spots.
So the one tumor in the back of the liver has grown, and it's kind of sprouted off all of these little nodules near it, tumors around it, okay? But more importantly, as I was showing, is that you've got new spots away from that tumor, new spots in the rest of the liver.
Can it be helped?
That's what I'm saying. They could still, right now, they're still in a spot where we can ultimately potentially kind of remove them or deal with them, right?
Mm-hmm. But he wants to get it
under
under control.
in the right setting.
Right.
Right? Because what we see on the CT scan may just be the tip of the iceberg, right? May just be the stuff that's big enough to be picked up on a CT scan. The likelihood is you've got a lot more stuff that's smaller, that's invisible on a CT scan because it's too small to be seen. That's in there, right? So that's why getting you on effective chemotherapy right now is important. Because that chemotherapy will not only treat the visible disease
The invisible.
and potentially get it to shrink, but it also hopefully really take care of all the invisible disease. You understand?
What about the mass on my left side?
Yeah.
That doesn't look like it's changed all that much, and kind of as we had discussed, it probably would mean taking your spleen and a little bit of your pancreas, but from scan to scan, that hasn't really changed, and so that our plan hasn't been altered, but we need to get your disease control globally, as Dr. Trincao was saying, under better control before it makes sense.
So they can't cut one without having the other one under control.
Right, exactly, right? Yeah.
So is there like a time frame maybe on,
Yeah, no, so I think what we need to do now, clearly, is go back to the drawing board and get you on better chemotherapy.
Okay.
I'll place the consult for you to see medical oncology. I hope, and I'll see if they can see you very soon.
Okay.
And then get you on chemo and get you started back on chemo, effective chemotherapy as soon as possible.
Okay.
And what's going to happen is that you're going to be on this new regimen for about four cycles or about a couple of months, and then we'll reassess. We'll get a new CT scan, see how things look. And if things go the right way, with the tumor start shrinking or, showing us that it's working, and your tumor marker, that CEA, remember it shot up today compared to before. I don't know if you saw that. It shot up to 64, and it was like 18 or something like that the last time. So clearly it tells us that the cancer is growing. If the CT scan shows things are getting better and the CA drops back down, that's a really good sign.
Okay.
That's telling us, okay, we got the upper hand on this cancer. Then we can strategize on the next best step. It may mean more chemo, it may mean time to do surgery.
Okay.
But that's what we've got to figure out.
Okay.
Okay?
And what was the time lapse between the 18 and 64?
Yeah, I mean, we're talking about just, 40, 50 days. So less
Like
than
a
2
month and a
months.
half?
Yeah, a month and a half,
So that means that
6 weeks.
I have to be off of chemo for a month before surgery again, and then it'll still have time to grow again.
That's a very good point. But understand this. I mean, that's why we're talking about really needing to get the upper hand on the cancer, right? Because we already know if we're going to take you to surgery, that is time we're committing you to not getting chemotherapy, right?
Right.
You don't have a choice about it,
Right.
okay? So we already know if we're going to commit to that time, where we're going
It
to
has to
obligate
work.
you, force you to not be on chemo, we better darn make sure that we're in a good spot when
Right.
we do that. You understand? Doing it now, it would be foolish, right? We already know the cancer is growing. We go to surgery, that's more time off chemo. That cancer is only going to keep growing and growing even more, right? So that's why we got to change course here. Okay? Okay. Other questions?
No. Well, I do have one. So when you put her in contact with the oncologist here, is there any way to get that done, like maybe tomorrow?
Yeah, I will do everything I can. We're gonna pull some strings, see if some of our friends can kind of get you in and see you.
Okay.
Okay, maybe
Okay.
even today. I don't know.
Well, yeah, today's fine because we
Y'all
check
are
out of our
staying in
hotel
South Hill
tomorrow.
Okay.
Yeah.
Yeah, let's figure out if we can get you to be seen by somebody here.
Okay.
Okay?
All right. Well, thank you.
Yeah, you're welcome. So we'll both see you back basically with the next restaging scan in about 2-3 months.
Okay.
Okay?
Yes, sir. Well, thank y'all.
Yeah, you're welcome. Hang in there. Okay? I know it's disappointing, but you have to understand that this is the right thing to do, okay? Okay.
All right. Thank you so
You're
much.
welcome. Okay.
Thank
You guys take your time, and we'll work on trying to get something
Yeah.
to see.
Okay. Thank you. It's not okay, but.
And I won't take your weight and height and vital signs because they already did it this morning, right?
Yes.
Okay. Thanks. it's the same contact sheet that they gave you this morning, but it's just the doctor's name and the PA. Our PA is Jeanette today because Katie's on maternity leave, and my name is Marianne. So if you need anything, if you send messages on my chart, I'll answer it, and then if not, I'll share it with the team. Okay.
And you said I'm gonna see Miss Jeanette today.
Yeah, and Dr. Shen. So usually the PA will see you first, and then the doctor.
So what's the PA after that?
Physician assistant.
Oh, physician.
Yeah.
Okay.
And then so Jeanette will see you first, and then Dr. Shen.
Okay.
Okay. And then they already did your vitals and all that, right? But I'll just have to ask you about the fall and pain, okay? Any fall in the past 30 days, Miss Marissa?
No.
How about pain right now while you're sitting there right now? Any pain? No pain. And allergies, oxaliplatin. Are you allergic to oxaliplatin? It's like a chemo.
Yeah. I don't think I'm really allergic to it.
Okay.
The nurse, my I can't think those pills I have to take. Not for iron, but the other one.
For
potassium.
okay.
Yeah, I make a long story short, my potassium was extremely low.
Okay.
She gave me the stronger chemo and the potassium IV at the same time, and I had a reaction to it.
Oh, okay.
Yeah.
But because they put it here like as an allergy, should I add it?
I don't think, because I told them to give it to me after that, and I didn't have any. Because I mean, I'm not in the medical field, but I knew she shouldn't have did what she did.
Right.
And I knew it was because my potassium was really, really low.
Oh,
so
okay.
I took a chance, and they gave it to me like another 2, 3, 4 times on my request.
Okay.
And they lowered the dosage a little bit, but it didn't affect me at all. I didn't even
the
get sick.
oxaliplatin.
Yeah.
Oh, okay.
Yeah.
So I'm gonna leave it, okay? Leucovorin, is this an allergy too? It's also like a chemo. No.
No, none of it.
No, not chemo.
No,
Okay.
no.
Fluoride preparation.
What's
Is this
that?
like fluoride maybe for dental work?
Oh,
Something?
no, I'm not allergic to that.
So I'll take it out, okay? And this is chemo also, bevacizumab.
I don't know why they have that on there like that.
So it's not,
'cause they've been
right?
doing it-
It's not,
yeah,
okay.
yeah.
So I'll take it out. So
Yeah.
I'll take out the bevacizumab, fluoride, leucovorin, and oxaliplatin.
Okay.
So on your allergy, it's only morphine,
Yeah.
okay? All right. Okay. And for medication, and for meds, it's a Cipro you're not taking. Dilaudid, you're taking this, right?
Yes.
Taking Ritalin, not taking, correct?
Right.
Flagyl, not taking. Miralax, not taking.
Right.
Okay. So everything I see, it's not taking. So
You
Is
don't
this
see no
correct?
taking now. It's just the Dilaudid. It's needed for
for pain. Oh,
Yeah.
okay. So the rest.
The rest
no,
is
not.
fine.
Okay, so I'll mark it later. And pharmacy is the same. Walgreens in Longview, Texas.
Yes.
Okay. Alright. How about symptoms, Miss Marissa? Any appetite change? Like eating less or
No.
eating okay,
more,
right?
more. Yes, ma'am.
Any chills or fever or cough recently?
Oh,
No. Any fatigue? Are you more tired than usual?
Not as tired since I haven't been taking the chemo.
Oh, okay. Would you say mild maybe or
yeah, mild.
mild? Okay. Any mouth sores, nosebleed, trouble swallowing?
Just the nosebleeds have
Nosebleed.
calmed down quite a bit, but I still see it from time
Like
to time.
on and off?
Yeah.
Oh, is it like runny?
No,
Like dry.
dry.
Dry, okay. Like when you sneeze or when you like clean your nose?
Just
like,
when I clean my nose,
Okay.
not when I sneeze or anything.
oh, okay. Just dried blood. I put it there. Any trouble swallowing? No, right?
No.
Any shortness of breath, chest pain, leg swelling, any abdominal distension, feeling
Mm.
tight or bloated?
No.
No. Abdominal pain? Sometimes,
No.
occasionally?
Yeah, every once in a while.
Once in a while,
but
okay.
Not bad.
Not okay. I'll just put occasionally. Okay. On your right side, left side.
Both.
Both.
Since I haven't been taking the chemo, I've been feeling a little pain on both sides.
Oh, okay.
Yeah.
If it hurts, like how bad does it hurt? It's like 0 to 10, 10 being the
I'm
worst.
gonna go ahead and say 5 or 6.
5 or
Since I
6.
nip it in the bud as soon as I feel
yeah.
it. Yeah.
Is it like a dull or sharp pain or
Right now it's a
throbbing?
dull pain.
Dull pain? Okay.
Yeah.
And it's not constant, right? It's like on and off, like you
On
said.
and off.
On and off.
Yes.
And any anal bleeding,
No.
blood in stool,
No.
constipation,
No.
diarrhea, nausea, vomiting.
No.
No. And your last bowel movement, Miss Marissa, was it today?
Yes.
Yesterday?
Last night.
Last night. Okay, yesterday. Was it loose or formed?
Formed.
Formed. Any difficulty urinating?
Oh,
Like
no,
peeing? No. Okay. Any rash or bruises?
No.
Or do you bruise easily?
No.
No.
Definitely from those IVs, cause she got a like
Oh, and they got stuck in the.
Yeah.
Oh, okay. No problem. Any neuropathy, numbness, tingling in the hands and feet? Yeah.
And in my legs, preferably my right leg.
Right leg. Okay. So neuropathy. Any dizziness, lightheadedness? No, not really. Okay. Any anxiety or insomnia, like trouble sleeping?
Sometimes.
Sometimes. Okay. Alright. And are you getting chemo here, Miss
No.
Ward, or you're gonna do it locally? Like
we want to do it here.
here? Oh, okay. All right. Do you have the information of your local oncologist?
I can get it. It's Dr. Normal in Longview.
Ah, okay.
Yeah.
Let me see. Do you have his phone number? Let me just check. Okay.
I have a Texas Oncology phone number, but not.
Oh, okay. I have Dr. Nirmal. Is that a good contact in case we need to reach out to them? Kavita Nirmal?
Yeah, but but I'm gonna, like I said, I don't really know what route I'm gonna take yet, but I don't really want her too much as my doctor anymore.
Ah, okay.
Yeah.
All right.
So I don't know yet.
Okay, no problem. Okay. Any other symptoms otherwise, Miss Marissa? No? Okay. Alright, I'll let them know you're ready, okay?
Okay.
Thank you.